Okay, we will call this meeting to order. It's just the study session, which we're always excited to have. And right away, I want to introduce Gisela, who's with the Language Justice folks. Thank you so much, Gisela, for being here. We really believe in having, complete inclusive and appreciate that you all come every single board meeting. So go right ahead.
Thank you very much. Well, thank you for having us. Thank you for your commitment to language justice. Thank you for giving an opportunity where people can participate and engage in the language of their heart, the language that they feel most comfortable in. That is the language that we practice at home. So to create this space, we're going to be using simultaneous interpretation. So when I finish saying this in Spanish, we will turn on interpretation, and you will see a globe icon on the bottom of your bar that says interpretation. If you're not fully bilingual, I ask that you select your preferred language if it's English or Spanish. And if you're bilingual, you don't have to use our services. And if you are joining today from a phone or a tablet, it has 3 dots on the bottom that says more. You can click on it and you can select your language as well. If you're going to be presenting or facilitating, please be aware of your speed, knowing that Spanish takes 20 to 25% longer than English. If you have any questions, you can just let us know. Now I'm going to say this in Spanish. Hola a todas las personas. Mi nombre es Gisela Escobedo y estoy aquí con la Community Language Coop. Y quiero darle las gracias a los organizadores de este evento por su compromiso a la justicia del lenguaje. Gracias por crear una oportunidad donde las personas pueden participar e involucrarse en el idioma de su corazón, en el idioma que se sienten más cómodos, que es el idioma que practicamos en casa. Así que para crear este espacio vamos a estar usando la interpretación simultánea. Cuando termine de decir esto, vamos a aprender interpretación y usted va a ver un icono de un globo en la barra de abajo de su pantalla que dice interpretación. Si no eres completamente bilingüe, te pido que selecciones tu idioma preferido. Y si eres bilingüe, pues no necesitas usar nuestros servicios. Si estás desde un teléfono o una tableta, vienen 3 puntitos que dicen más o more. De ahí seleccionas tu idioma. Cualquier pregunta nos lo haces saber. Muchas gracias. Thank you very much. You can go ahead and turn on interpretation.
Thank you, Gisela. Okay. We have a great presentation today from our environmental health services. It's on the methamphetamine affected properties regulations and program. We're excited to hear the information on that. I know it's a huge issue. And let's see, who are we have going to do that? Jim, are you doing that?
Oh, let me introduce my program manager,
Perfect.
Madison Pitts. Will be introducing the topic this afternoon. And I will have a few comments near the end of the presentation. Madison manages this program along with our air quality and indoor environments work as well as our environmental land use programs. So with that, I'm going to turn it over to Madison.
All right, give me a second. I think I'm figuring out. Does everybody see my slides?
Yes.
Okay, perfect. Good afternoon, everybody. Hope everybody's doing well. It's a beautiful day outside. I'm just gonna, like Jim said, I'm gonna start off giving a little bit of background about the meth affected properties and what we do within Environmental Health Services division regarding this program. And then Jim's gonna take it over and give some additional information on some issues that are arising in the county as well as some surrounding counties. So just a little bit of background. In the late 1990s, clandestine drug labs were a hot topic. They were popping up everywhere, all over the country, all over Colorado, and that it does include Jefferson County. Of course, unlike controlled manufacturing of chemicals and drugs, these illegal manufacturing do result in uncontrolled storage, use, generation, and disposal of a wide range of chemicals, and eventually does deposit methamphetamine drug residues on indoor surfaces. So back then, not many agencies had meth programs. So we elected to become the governing body overseeing that remediation is completed per the state statute. When the program started, we went to all the municipalities and asked them to designate us as the governing body. And then the Board of County Commissioners did designate Jefferson County Public Health as the governing body for the purpose of enacting and enforcing regulations under CRS 2518.5-105. This was intended to address the meth labs in the county, but evolved into self-reported properties. So as you can imagine, there's a variety of health issues. These residues have been found at high levels, both on porous and non-porous surfaces, and have been shown to persist for months to years. Persons exposed to these environments often have poorly defined exposures and health effects. It really does depend on what the contamination level, if it was a drug lab versus use or storage. And then, of course, the length of exposure that person has. So it has been typically poorly defined exposures and health effects. But exposures to meth contamination can pose significant health risk, both in short term and long term. Some of the health risks associated with exposure to meth contamination do include respiratory problems. Those respiratory problems can cause irritation to the lungs, leading to breathing difficulties, coughing, and wheezing. And then long-term can cause chronic respiratory problems such as bronchitis or asthma. I realize I was talking really fast, so I'll try to slow it down for our interpreters. My apologies. Neurological damage, because methamphetamines are a powerful stimulant, it can also cause damage to the central nervous system. These can cause headaches, dizziness, and seizures. Long-term exposure can cause more severe neurological problems, such as tremors, memory loss, and cognitive impairment. Of course, if you come in contact with any meth contamination, you could have some skin irritation, rashes, and sores. And then long-term exposure can lead to more serious skin conditions, such as dermatitis or eczema. There is a high concern for young children with meth contamination, because ingestion of this contamination can cause GI problems, such as nausea, vomiting, and diarrhea. And then, of course, with prolonged exposure, that can increase your risk of developing certain types of cancer, such as lung cancer and leukemia. Another point I just wanted to put in there, I realized that this might be a little out of place when I was going through it earlier, but there is an additional risk other than just indoor surfaces in a residential home if that home is on an on-site wastewater treatment system. So of course you would go through similar steps to cleaning that up, but that is just an additional thing that you would have to worry about cleaning the septic system. You would want to make sure it is cleaned thoroughly, involving pumping and cleaning the tank and flushing the system with water and cleaning agents and disinfecting the system. But I would like to also point out that that would affect the surrounding environments and cause contamination to those surrounding environments. So as far as regulations, the purpose of Jefferson County regulations are to reduce and mitigate the known and probable health and environmental consequences that result from the use of residential property to conduct activities associated with illegal drug laboratories. Our regulation imposes testing, cleaning, and certification requirements of the property owner as a condition precedent for the use of the property, and to provide public notice of these properties that they have not been remediated. Jefferson County regulation intends to address residential long-term exposures and gives the department the authority to put notice on the title of meth affected properties if not mitigated to standards. Statutes and regulations do require that properties contaminated by meth must be cleaned up in accordance with standards established by the State Board of Health, or the property can elect to demolish the property instead. This also applies basically to anything contaminated, so it could apply to vehicles as well. while the intention of the regulation is for residential properties. A property owner who cleans up the property in compliance with the regulations do have immunity from civil lawsuits by future owners, occupants, or neighbors related to the meth lab, as long as verification testing has been conducted. It is good to note that today's statute does specifically describe an illegal drug laboratory as areas where controlled substances, have been manufactured, processed, cooked, disposed of, stored, and used in all approximate areas that are likely to be contaminated. So while it specifically says drug labs, they're kind of considering everything, whether it's just an area where it's used or been stored. So what we do specifically, we are responsible for enforcing the regulations under state statute. We do not conduct any testing. I'm sorry. We typically receive notification either by law enforcement or non-law enforcement. Upon that notification of a contamination of property, property owner does have 10 days to decide how they wish to remediate. Upon notification to this department, we do issue a notice of violation and placard the property. I will show you an example of the placard on the next slide. That notice of violation is issued to the property owner to inform their property has been confirmed as a public health nuisance, and they must either remediate or demolish the property. And then they have to report to us within 10 days of their discovery what they wish to do, whether they're going to remediate, demolish, etc. The property owner does have the ability to request a hearing. If the property owner does not respond and remediate or demolish the property within 6 months, we do put a notice of non-compliance to the title. That's to prevent any kind of sale without that being public information. So we do have the responsibility to provide the property owner in the notice violation that they have that right for administrative hearing to be able to contest the public health nuisance. If they do not respond within 6 months, like I said, we issue a notice of non-compliance on the title. Once the property has been deemed a public health nuisance, no person shall enter the property unless certified or accompanied by a certified personnel. And then once they go through the process of remediating, we do receive a clearance report from a consultant who does have to be approved and in good standing with the state. But they submit a clearance report to us saying that they sampled the surfaces and there's no longer meth contamination present. And then we do allow individuals to enter the property at that time. If all items required to demonstrate remediation have been met, a compliance letter is issued to the property owner, and then that placard may be removed. A property may also be considered remediated if the property was demolished, and then for them to do that, we do have to receive a demolition permit. So here is a quick example of placarding. That is a huge sticky piece. It would have to be intentionally pulled down. It is provided both in English and Spanish. And basically it cannot be removed until we give the permission to do so. And it gives public notice that the property is unfit for human habitation. Nobody may enter the property unless they're with the certified person. And then I will give it over to Jim.
Thank you, Madison. Undoubtedly, most of you have probably been made aware of or have heard stories regarding contamination being found in public areas of facilities like libraries or other public buildings. Neither the state regulations nor the JCPH regulations differentiate private areas from public spaces in terms of the requirements for testing or decontamination. Once methamphetamine contamination is discovered, either through direct evidence or reporting by law enforcement or environmental testing, then the state regulations kick in, as well as the county regulations. You probably all heard of the stories in November, December 2022, where discoveries were made in several of the libraries across the metro area as a result of non-regulatory testing. Those libraries in Boulder, Littleton, Inglewood, and also our own Arvada Public Library. This non-regulatory testing, which was ultimately shared with the local health departments, caused the regulations to kick in, and they constituted discovery and therefore required each entity to proceed with testing and decontamination. Because regulatory action has been initiated in these facilities, they needed to be closed in order to prevent exposure to the residual chemicals for either the workforce or other visitors to the facilities. When we were notified of the Arvada Public Library from them of the identification of contamination in their facility, JCPH and the county attorney's office connected with CDPHE right away and found out that reduced testing and decontamination could be possible for the library, and we had them work directly with certified consultant and CDPHE to apply for a variance, which is allowed by the CDPHE regulations. The Arvada Public Library consultant assessed the facility and, based on the findings, applied for and received a variance from CDPHE, allowing for opening of restricted areas, those that were not accessible to the public, reduced testing, and reduced decontamination requirements. So Jefferson County government facilities are not immune from this issue either. At least 6 incidents of suspected meth or other drug use have been reported at 3 different, maybe more, at least 3 different county-owned facilities since February of 2023. We've had a relatively low number of reports, and they represent sporadic incidents, and this, combined with the assumed small quantity of drugs being used at the time of discovery, to us represents a very low health risk, and we've been consulting with a number of our neighboring health departments, the Colorado School of Public Health and others, and really the use of methamphetamine or other drugs in these public spaces is considered a very low health risk. We've been working over the last several weeks to develop new protocols for managing these types of incidents, and preliminary protocols were distributed to all JCPH staff last week. And we are working on refining with this county attorney's office and several other county agencies on refining those protocols, which include reporting to management when suspected drug use has occurred in a county facility, posting signage at the doorway or entrance to that space, trying to close it off or prevent people from entering those spaces, to allow for adequate ventilation of those spaces before they're put back into use. We're also asking, and we're creating a incident report form that would be submitted to the facilities director, myself, and the county facilities email address. I think we're still discussing exactly where those reports will go to, but they're really designed to, help us capture information and data about where these incidents are occurring and how frequently they're occurring. Following submittal of the incident report form, there will be a request for follow-up cleaning to occur in those areas, and we will evaluate the need for deep cleaning or extensive decontamination based on the number and location of these incidents, or perhaps the type of incident that occurs. We'll be working over the next, as I mentioned, several weeks with the county attorney's office, as well as the county facilities management and other agencies, to finalize the reporting and response protocols for incidents in the county-owned facilities. We intend to communicate risk about exposure or these types of incidents and the risks that they represent, as well as the response efforts that we anticipate needing the county staff to follow. We also want to make sure that we're providing adequate information to the public. Some of our partners in other local public health agencies have also initiated this process, and we hope that we will be working with them as well as CDPHE to create good, consistent, thorough information about the risks and efforts to respond to these types of incidents in public spaces. We also are working with county facilities management, exploring a project to install methamphetamine sensors in certain areas, or at least starting with a pilot project to see how adequate these sensors would be in terms of identifying when meth use is occurring in public spaces. The idea there is not to necessarily try to catch people in the act of using drugs, but more so using the app that is associated with these sensors to identify when and how many of these incidents are actually occurring in public spaces. We also intend to work with CDPHE on guidance and possible regulation changes. In fact, next week, CDPHE and a representative of the School of Public Health will be meeting with the Colorado Directors of Environmental Health at their quarterly meeting to discuss this issue of methamphetamine and perhaps other drug contamination issues in public spaces, and what needs to happen in order for us to be appropriately addressing contamination, use and contamination issues within public facilities. We also intend to work with agency staff across the Jefferson County government to identify and implement effective strategies to discourage and reduce drug use in public areas or in public facilities. That question came up when I distributed the information last week as to what are we doing to stop drug use in county facilities, and especially in our own public health department facility. And it's a really challenging question because we really want to, many of the folks who we assume or maybe believe may be using drugs in our facilities or in other county facilities are people who really need our services. So we need to work with those program staff and other folks within our organization to really come up with ideas on how to discourage folks from using in public spaces. That is all I have. I'm happy to answer questions or Madison. I also have Assistant County Attorney Kathy Parker, I see on the attendance list today. Kathy's been helping us quite a bit with really getting an understanding of the legal and regulatory aspects of methamphetamine affected properties and how these are most appropriately addressed.
Jim, I have a question.
Sure.
My understanding is that unless law enforcement has been involved in some way, I mean, there's no way that the department or anybody else would be notified that a property, a residential property, had been contaminated.
So,
So how do we
Medicine can
know?
yeah, if a homeowner or property owner contracts a consultation company to come in and test, see if there was meth contamination, then that company does send us those reports over. Usually it's like a screening that's one sample. If it does come up positive, we don't use that as like enforcement purposes, but we do send out notifications saying, hey, we need to get it thoroughly tested. And then if that comes back, that's when we start the 10 days to remediate or decide to demolish.
And so that's a voluntary thing that the person, let's say, purchasing the property,
Yes.
or the landlord, before somebody else moves in, would have to request a testing.
Yes, to my knowledge, unless it's unless there was police enforcement there, and then they would notify us. We do work with the city of Lakewood as well, hand in hand. Any meth affected properties, they let us know, and then vice versa, we keep them in the loop as well.
Thank you. Are there questions from the other board members? Just chime in.
I don't have any questions, but thank you for sharing this. And I definitely look forward to, as you're identifying kind of the scope of how pervasive this is and additional updates.
We'll keep you tuned in.
Ditto. Harriet, did you have a comment?
Yeah, and I was trying to find where I could raise my hand on my keyboard. So my question, just you said you work with Lakewood. Is that the only municipality you work with, or do you have a similar relationship with all the municipalities in the county?
So I will start off by saying I just took over the program. Mitch Brown, another supervisor, he had the program before me. Lakewood is the only one that I know that we have any kind of data sharing, as far as we send out each month a list of properties within Lakewood that are contaminated, and then the status, whether it's been remediated, and we've received that decontamination report. To my knowledge, Lakewood is the only one.
Do you have a clue as to why the other, I mean, my
Don't.
question is, I guess, has the county reached out to the other municipalities, which I'm sure they have? What is the reason that they wouldn't want to work with, get on the same page as everyone else?
I don't know, Jim, you might be able to provide better insight.
I believe the regulations apply everywhere in Jefferson County.
Yes.
And the police officer were to, or law enforcement were to report a contaminated property to us from Golden or Arvada or other places, we would still be bound by the same regulations to follow through on the enforcement and implementation of the county's administrative regulations for this program. So I think Madison's point was really about, we have a relationship with Lakewood to share information and data back and forth to make sure they know at all times the status of the properties that they have reported to us or that we've had reported in other ways, so that they know where these properties are and they can keep an eye on things. They help us out with enforcement of the placarding regulations and make sure that nobody's entering properties and things like that.
Yeah, I would just assume that they all would like to have that data sharing, but shows you what I know.
Yeah, I feel, well, I think that it's a huge issue within the county, and I'm sure there are properties that might not be under our radar because they might not be tested or whatnot. So it would be a rather large program, maybe for each municipality. I'm not exactly sure. I just, yeah.
Is it the police department that you have the relationship with, or another part of Lakewood government? Because I know the Lakewood Police Department has a really robust data system that I think some of the smaller municipalities don't have.
I am not familiar. I would have to look that up in my email.
Okay, that could be the reason.
Further comments, questions from the board?
Hi, Madison and Jim. This is Rochelle. I just wanted to thank you both for bringing this presentation to us. This is definitely some valuable work that you're doing, and I appreciate the work that you do in this area. I'm going to second Lane that I look forward to updates in the future on how things are going and the progress that you're making. And Madison, I believe I heard you say that you just got into this position and you're taking over for somebody. So great job. You did a wonderful job, and that's awesome. So thanks. I look forward to hearing back from you again.
Thank you.
And thank the entire department for all the work that you all have done, Madison and Jim, on this, because it is important. You know, we tried to get the realtors to put in their contracts that they had to ask the question or report if a property had been, and that didn't go so well. So they didn't like that. So we couldn't get that through, but thank you so much. If there's no other questions, then you all can be finished, and we really appreciate your presentation.
Thank you very much.
Thank you.
Thank you. Okay. It looks like we are right on target for the time. So let's call the Jefferson County Board of Health committee to order. And first of all, we'll do roll call, and then Gisela, I'm not sure that you need to repeat. Lindsay, does she need to go through the language justice stuff again? Because we're still continuing, right?
Correct. Yeah,
Yeah,
I think Gisela, if you want to put directions in the chat, you're welcome to. Otherwise, I don't think you need to.
Yeah, I think that'd be a good idea. So let's do a roll call.
Okay, Rochelle Woods,
Present.
Hilda Gerke. I believe she is not on yet, but let me just double check. Correct.
Hilda has notified me that she has been held up at work.
Oh, okay.
So she'll try to get on, but she's held up.
Okay, thank you. Harriet Hall,
Present.
Lane Drager,
Present.
Sherry Jean.
Present.
For the record, Hilda Gerke is absent and a quorum has been established. Thank you.
Thank you, Lindsay. Okay, let's jump right into our agenda. We have the consent agenda up first. We have the acceptance of the agenda, approval of March Board of Health meeting minutes. I hope that you all were able to read through those, the approval of warrants, and the approval of contracts. And we have just the one contract, Colorado Department of Health and Public Health and Environment Immunization Corps Task Order has gotten another contract. So are there any questions on any of those that we need to address? Or can we have a motion to move the consent agenda forward?
I would move that we accept the consent agenda.
We have a
Second.
motion. We have a second by Lane. All those in favor, please say aye.
Aye.
Aye. Anyone opposed? Hearing none, that motion is adopted. Public comment, and it is my understanding that we don't have anyone. Again, I will just remind if there's anyone from the public listening in that we have a great process that you can sign up to speak to the board. We don't have a dialogue back and forth, but we want to hear your questions. We want to hear your comments so that we can get those to the places that they need to be. And you can sign up. You have to sign up. I think it's by noon, the day of the actual board meeting. So you'll have to pre-sign up, but there's no one for today. Okay, financial report. Joe, you're still filling in.
Good afternoon, everyone.
How's our new mama doing?
I believe she's doing very well.
Oh, good.
You know, when you ask me that question, it's a little confusing because we have a
Well,
4-month-old.
that's true.
So-
You do.
I think all the new moms are doing well as far as I'm aware.
Oh, good.
Thank you for asking, Sherry. Good afternoon, everyone, members of the board. Today, I'll be presenting the March year-to-date financial statements. I hope everyone can view the financial statements, at least the dashboard of the department report, and that it is large enough. Sorry, if I need to enlarge the document, please let me know. I'll start by looking through the year-to-date column. This is pretty much where I'll be focusing most of my attention. The grant funding at this point is roughly about $3.4 million of a $12.7 million budget. Of course, this is pretty substantial when you look at our total overall budget. So making sure that we are on track with our grant funding is critical to our department. We are indeed a little bit ahead of our trend. Through a quarter of this fiscal year, we are reporting about 27% of our annual budget. Charges for services, which makes up our restaurant licensing, clinical services, the services that we charge and we receive payment for services. We have a budget of $2.7 million. And at this point, we have obtained about $1.2 million of that budget. That is indeed 43% of that annual budget. And as I'd mentioned in the previous report from last month, that is pretty typical for us to receive a larger size of that portion, or a larger portion of that budget in the beginning or the first quarter of the fiscal year, due primarily to restaurant licenses being paid up front or toward the beginning of the year for the entire year. So we are on track, or this is an anticipated overage at this point. Total revenues at this point that have been retained by the department is $4.5 million, roughly about 29% of the annual budget. Expenditures, I won't go through each of these lines. Of course, there are some percentages a little higher than others. I can get into that detail if necessary, but please note that for the fiscal year, we have a $24 million expenditure budget. Of that annual budget, we've already expensed roughly about $5.4 million, or 22% of our annual budget. Due to the expenditures exceeding the revenue that we've realized thus far, with $5.4 million of expenses and $4.5 million of revenue, we have relied on the county or county general fund funds up until this point of approximately $862,000 to balance our budget. That is approximately 10% of the annual general funds that have been dedicated to public health. I wanted to take a quick moment and mention that with these percentages, although we are over our budget, our prorated budget for revenue, we are under budget for our expenses. Of course, there's reasoning behind that, with vacancies, with several positions being vacant. Realistically, I'd like to comment that, you know, our staff are fiscally responsible. We follow our grant budget as closely as possible. We are aware of costs and try to streamline those services as best as possible. But being slightly ahead of total revenue budget and slightly below total expenditure budget is in line with the trend that was reported last month. So although we are 4% over our revenue budget at this reporting period, we were approximately 4% over our budget last year. So what we're seeing is these trends that are aligning or keeping the same distance from where we expect to be with our budget. This is showing that fiscal responsibility and that stability with our budget at this point. And just further down, I just wanted to show that, of course, we have our fund balance specifically for public health at $1.7 million. These are our reserves that we've had for several years, at least the 10 years that I've been with the department. We've had approximately $1.7 million. It was a little higher. I think one year we had to utilize some of it, but we do have a small amount of reserves that still are being maintained. That is all I have to report with this year's or this reporting period's financial statements. I'd like to address any questions if there are any at this time.
Thank you, Joe. Are there questions from the board? I'm not seeing any. Thank you, Joe.
Thank you.
Okay, let's move right on.
Mary, I
into-
would move to approve the.
Oh, sorry. Lane has moved to approve. We have a motion. Do we have a second?
I'll second that.
Yay. We have a motion and a second. All those in favor, please say aye.
Aye.
Aye. Any opposed? Seeing none, hearing none, that motion passes. It is approved.
Thank you.
I was excited to get to the next part because we've been working so long on this and we can't wait to tell you all. We've been working on the June 22nd Board of Health all-day work session. And we have these two fabulous ladies who have been working incredibly hard. And they're going to do a presentation so that we can have a discussion. You all can, they can answer questions. And that is Sarah Miller and Amy Downs from the Otawi Group.
Hi.
Thank you.
Welcome. Thank you for welcoming us. I just want to check to make sure you can hear me. Am I being heard okay? Oh,
Yep.
Awesome. Thank you so much. Well, we're just thrilled to be here with you today. Thank you for welcoming us to your meeting. Today's objective is to take you through as Director was explaining, and we would just like to walk through a little bit of what we've heard and a little bit of what we have planned for your June meeting. My name is Sarah Miller. I'm the owner and manager of Ottawi Group, and I am excited to also introduce you to Amy Downs. Amy?
Hi, everybody. My name is Amy Downs. I'm a health policy consultant working with Sarah.
Thank you, Amy.
Great. So I just want to just briefly share with everybody that Ottawi Group, we work to improve structures, systems, and programs by developing effective partnerships and generating solutions. And we are a consulting group that works with public health agencies, nonprofits, both at the and then state and local governments and communities that are just working to address complex health issues and social issues and organizational challenges. And so we've been working with Jefferson County Public Health since early 2022, and we're using a lot of our experience to help facilitate meetings of your senior leadership team and their shared leadership model. We're supporting the implementation of strategic projects identified throughout the organization. We're doing some public health analysis work and working on some leadership development. And we are just thrilled to be able to move to supporting you all as the Board of Health. So I'm going to share my screen, which we'd like to walk you through our proposed agenda. It's in draft form. And so let me walk through this. I think I'm going to get to the right one. So what you should be seeing, it's hard for me to see on my side, is what says draft agenda with a yellow draft. Are you seeing that?
Perfect. Yes.
Okay, good.
Yes.
I'm seeing some nodding heads. So thank you for that. So we're really interested, as we know you are as well, to make sure that your retreat in June is helpful to the board and addresses the topics that you all think are most relevant. We were able to conduct one-on-one meetings with all but one of you to learn more about what you would like to gain from the retreat in June. And we are intending to make sure that we meet with that last person after this meeting and before the June meeting. So that will occur. And based on your input, we identified some common themes. And so this draft agenda is intended to support the following desired outcomes. We intend to increase knowledge of each other and building of relationships, increase our clarity on roles and responsibilities of the Board of Health, specifically in the 4 areas of legal, financial, executive director, supervision, and community engagement. We're going to strengthen relationships with your senior leadership team and strengthen plans for community engagement and strategic planning. So that's what we want at the end of your meeting as an outcome. And the outputs that we intend to have are a schedule of yearly activities, a clear pathway on strategic plan established, and identification of any additional training or discussions that you all need to have to continue your work. We are going to be asking you to do some pre-work, so we want to give you a heads up on this, and it'll be coming to you, and some of you have already received this. We're going to ask you to complete the new Colorado Department of Public Health and Environment Public Health Training Series. They have 2 new trainings that they have issued, and so we're going to ask you to do that. We're going to ask you to reread those bylaws and also reading a Board of Health pamphlet that many of you have seen. We're just going to ask you to read it again to refresh your memory. So we'll continue with Amy, and then we'll stop and pause for any questions that you might have or clarifications that you might have after that.
Great,
Amy,
thanks, Sarah. So yeah, we've put together a proposed agenda that Sarah is sharing with you now that's really based on the feedback we heard from you. So I'll run through that quickly, and then we'd love to get some feedback. So first, we want to start the day by engaging in some team building. We heard from many of you that because there's a number of new members on the board, because your meetings have been virtual, it's been challenging to get to know each other. And so we propose to kick off the day with some team building, and then have some additional team building sprinkled throughout the retreat. As Sarah mentioned, we want to spend some time defining and clarifying Board of Health roles and responsibilities. So we'll be reviewing some of that pre-work that Sarah mentioned earlier, those CVPHE trainings, the bylaws, and the Board of Health pamphlet, and reviewing any questions you have from those documents. We also want to do a deeper dive on some particular topics that you all mentioned, including your financial role, your oversight process of the ED, and engagement in the community. We also heard about engagement of board members among each other. And so, of course, as you've all talked about before, as a public board, you need to make sure that any meetings that include conducting business are open to the public. So we're proposing to have an agenda item be a discussion about how you can engage with each other, how you can exchange ideas, how you can do all that, improve your engagement within the parameters of the law. After we get through that, we're going to have lunch. And at that time, really want to bring in your senior leadership team because we think it's really, and we've heard from you, that it's really important to be engaging with them. And so we'll have them come for lunch and plan a team building exercise for all of you to get to know each other a little bit better. During your session with the SLT, we also wanted to spend some time on public health content and staff engagement. You all bring really important and different expertise to the table, to the public health table. And so what we heard from you is that it would be helpful to have a discussion about how to provide more exposure to all of you regarding content of JCPH programs and how you can engage more with staff. So it's not that in this agenda item we would be going over that public health content, but it's more about coming up with a plan, coming up with a schedule. How do you want to go about doing that, and what is your strategy for that? So we also talked to the SLT about what they would like to engage with you, those different topics. And one of the items we heard was the role of the Board of Health in policy development, and having a discussion with all of you about the role you want to play in terms of policy at the county level, what you want your engagement to look like, what you want their engagement to look like, and on what policy topics. And then the last item with the SLT would be talking about strategic planning and having them review some of the work that's been done in the past how they've been operationalizing the current strategic plan, and really bringing you all up to speed on that. Then after that, we would have you all have a discussion about strategic planning moving forward, and what you would like for your engagement to look like around that, and really have you all have a discussion about clarifying your expectations for the strategic planning process at JCPH. As we mentioned, we wanted to come up with a yearly meeting schedule and agenda. So what does that schedule look like on the public health content side? And also have a discussion among board members about the format of your meetings. Will those board meetings be in person, or will they be hybrid? What are your thoughts about how you want to meet moving forward? And then we're proposing to close out your day with some additional team building, just kind of coming back full circle to where we started and allowing you all the space to get to know each other better. So with that, we'd love any reactions or feedback to what we've proposed.
I just have one quick question. This is Sherry. As we were going through this, something else crossed my mind. I'm not sure if we talked about it. Probably not, because you guys would have. Where would we be able to plant just a very short, what would onboarding of new board members look like? Who would do it? Because that seems to be the issue that we run into with the board, that, you know, there's turnover because of term limits. You know, somebody is termed or cannot stay on the board. And so then we have a new member. So it's not like the whole board has to go through it every single time,
Right.
but we need to have a process for onboarding. Not much, I mean, it wouldn't take long, just we need to figure out what that would look like.
Yeah,
Right,
we can definitely, oh, go ahead, Sarah.
You were going to say exactly what I think I was going to say, so go ahead, please.
No, I was just going to say, we can easily weave that in. I don't think that would take a long time. I'm thinking it could be under board engagement.
Yeah.
What do you think, Sarah?
Mhm.
Yeah.
I
Like
think
what
that's
is the
perfect.
plan for that? What is the strategy, and how do you come up with that onboarding process?
Yeah, thank you.
Sure.
Board members, what do you think? Comments, questions, additions? I know it's a full
Lane,
agenda.
I see Lane, that, hi, you have your hand up?
Yeah, no, I think this looks
Okay.
very good. I think
Okay.
this covers a lot of the topics that I was hoping we could use our time for. So this looks really good.
Perfect, thanks for that feedback.
Second that. I think this looks great, ladies, and I appreciated having conversations with you to build this agenda.
Yeah, we're happy to.
Harriet, I see your hand up too, I think.
Yeah, I think it looks great. My only question would be whether the senior leadership team feels like the period for overlap and the issues for overlap are what fit their needs in terms of the time we spend together.
Are you expecting that to be discussed now? Because we could also take it back to the senior leadership team and show them, many of them are on this call right now, and have a discussion.
I don't necessarily need that it be addressed now. I just want to make sure that it's addressed, and that before it's totally final, that they have a chance for input. I should have made that clear. We don't have to discuss that right now.
Okay, beautiful. We'll make sure we get it back on their agenda so we can present to them and get their feedback and make any adjustments as well. For sure.
Any other comments or questions, suggestions? Well, I have to say, Amy and Sarah, it has just been wonderful working with you all. You all have worked very, very hard to take all of our thoughts and get it onto paper. So I've enjoyed working with you, and I know that all of us on the board appreciated hearing from you to figure out, what do we need to know? You don't know what you don't know, you know.
Exactly.
Yeah.
So thank you as well. And a lot of times after you've seen something like this, you'll have a reaction later. So if any of you want to contact us directly, you can feel free to do that, and we will continue to massage the agenda and then flesh it out as we go through the next month and have a really fantastic meeting with you in June.
Thank you. Okay. Well, thank you.
Thank you.
You're welcome.
Good work, you all. All right, let's move straight into the old business, and we're happy to have Dan Cummings here with EFL, who has been working very hard on the hiring of an executive director. Dan, would you like to give us an update?
I'd love to, Madam Chair. First of all, we're feverishly looking for and vetting additional candidates. I have a number of interviews pending. You all had interviewed a candidate yesterday that determined is not a fit, and that has been communicated to that individual. So we keep moving forward, and hopefully we'll have other candidates vetted for the board to consider very soon.
Thank you, Dan.
Mm-hmm.
Are there any questions or comments from the board? You're off the hook, Dan. I don't see anybody. Okay, Kelly Curl, she's going to give us a legislative update.
Hey, yes. Let me remember the mechanics of how to do this. All right, did that work?
Yes, ma'am.
Awesome. Sweet. Thank you again for giving me a few more minutes of your meeting this month. A quick update for you all. A big update from our last meeting last month is that the legislature has now rounded out the state budget. This process they were just launching into last month, and they've just rounded out, I think, in the last week. Going into session, it sounded like folks were estimating that they would have about $10 million of funding to use towards new legislation that would have an ongoing funding need after all this budgeting work. That's looking to be about $30 million from everything I'm reading and hearing about. So a little bit more funding than they thought, but it's still not a lot in the grand scheme of things. They did approve a number of the budget requests we talked about several months ago, closer to the start of session. That includes the syphilis project that CDPHE requested funding for that would expand the program that's currently in Pueblo to us and to El Paso as well. Some of their vaccine outreach and promotion work around routine immunizations, the funding request for the EpiTrack system that will replace a number of the current systems used for communicable disease management, and a few other things as well. So a lot of the details of that are still kind of shaking out. I'm seeing different figures in different places, but encouraging so far in some of what we're seeing come through. So I have a more detailed update for y'all probably next month on some of those budget requests. And looking at some of the specific bills, you'll see some throughout this update that we've talked about before. These are updates about where they are now in the process, as well as a couple new bills that have come through in the last month. You may recall last month we talked about a package of reproductive health related bills. There were 3. The 2 here are the ones that we think could touch our work more specifically, but all 3 of them ultimately moved through the legislative session and were signed by Polis, I believe, on Friday. Senate Bill 260 relates to how folks can access publicly funded vaccinations. This has included COVID vaccines through COVID response, but also routine immunizations that are offered through our Vaccines for Children program, as well as the 317 program. And during COVID, some temporary measures were put in place that this bill would now make permanent at the state level. So this primarily relates to not allowing providers to require certain forms of government issued ID in order to receive a vaccine that was purchased through government or public sources. These are practices that public health department clinical services have been doing probably for a number of years, maybe even before COVID. So this isn't anything new or a change in practice for us, but might be for providers that started to offer those vaccines throughout the COVID response, or who are in private practice, commercial pharmacies, that kind of thing. So it does help make a permanent change to reducing those barriers for folks that can't or won't provide that documentation. and it wouldn't be able to be immunized as a result. So now it provides some reduced barriers for those folks. And around our behavioral health and substance use bills, last month we talked about Senate Bill 171. This would require very large entertainment facilities that have like 7,000 or more seats to offer a substance-free seating zone. Ultimately, this bill didn't move forward. It would have been the first, would have made Colorado the first to have a state law around this particular approach, although it's been voluntarily adopted in other places. So be curious to dig more into those efforts, hear more from our recovery communities. It wasn't sounding like a whole lot of stakeholdering had gone into this particular bill, but would be curious to get a better sense about what those communities and the entertainment facilities would feel about a particular policy in this vein. And a new bill around substance use that came up since our last update is House Bill 1279. This would adjust state language. There's been some changes since it was first introduced that would allow in some way online sales of recreational cannabis products, and may also allow delivery, although exactly how that would work is still not clear. There would need to be rulemaking procedures if this bill ultimately came forth and was adopted. We're connected with our policy technical assistance folks over at the School of Public Health, and they're watching it as well. And we're trying to work out if this bill moved forward, what it would look like around local control. Right now, local municipalities have to actively opt in to allow things like delivery. Many of the municipalities in Jeffco have passively opted out. So we would want to make sure that we understood if this bill went forward, how it would affect those municipalities that haven't made an active decision one way or another about if they do or don't want to allow cannabis delivery in their jurisdiction. So we're still digging in on that one a bit. And then the community safety and violence prevention bills, these were introduced as a package. They've moved through, they have been passed by the second chamber respectively for each of these bills, but they have not yet been sent to Governor Polis. So we'll be keeping an eye on when that development takes place next for these bills. So that's all I have for you today. We will be watching some other bills that we've talked about before that should be moving through the process now that that budget question is clearer or more ironed out. So we'll have another update for you all in May, which will be about a week after session ends. I think session ends May 8th this year. So I'll have a quick kind of wrap up update on where the status of some of these other bills ultimately end up in the process. But would love to hear any questions or reactions that you all have for this.
Are there questions for Kelly? Sometimes that stuff moves very, very quickly, Kelly, although it doesn't seem to be moving fast this year, but there seems to be too many battles on the floor. Questions for Kelly on any of the legislation? Well, thank you for taking the time to follow all that and give us a report and keep us updated.
Definitely.
We appreciate that. All right. How about we'll move right straight into the senior leadership team updates, and Jody, you would be first.
Good afternoon, everybody. Thank you. Just a quick update on our community health assessment and community health improvement plan. As you know, that's typically a 5-year cycle that we do, although the last time we had done it on a 3-year cycle to align with our hospital partners so we could do a joint assessment and a joint health improvement plan. Then we shifted back to the 5-year cycle which is required by state law. That's what is required by state law because of COVID. And we are now just wrapping up our community health assessment and shifting into the community health improvement planning process. So should be seeing more in the coming days about that assessment from our health communications team. And just really want to thank the health planning team. They've had leadership changes, organizational changes, a lot of things to deal with through that, staffing changes, but have spent the last year developing that assessment. And now we're really looking forward to working with our community partners. And we worked with community benefit organizations on that assessment. So basically just gathering as much data and information from our community, from the data as we could to help us inform strategies for our health improvement plan. So now we take all that data, take all that information and develop it into a plan and some strategies. So just looking forward to working with everybody to pull that together. And I believe that's due in early 2024 as is our accreditation process. So we got a lot going on over this next year. That's all for today. Thank you.
Thank you, Jody. Joe.
Yes, thank you. So last month I had mentioned during during this update that we were kicking off the budget process for next year. I just wanted to update the board to let you know that we are moving along in that process, engaging with our staff. I am hopeful, little shorthanded at this point with my accounting supervisor on leave, but hoping at this point next month that we will indeed have that first draft for our program staff, for our department leadership team to review and really open up a little further those discussions around support for next year's programs, funding around support for next year's programs. I will also say that as the SLT continues to have conversations with various groups within the department on, project updates, project needs, financial needs, we are also discussing future planning. So as we are looking at utilizing, as I mentioned earlier during the financial report, that we have a little bit of a gap, a little bit of savings that we're trending with throughout this fiscal year, that we're trying to utilize that funding, that availability, that flexibility earlier, sooner rather than later. We are also opening up that conversation for next year's planning as well. So having that full encompassed conversation, not only for current financial situation, but planning ahead for next year. I also wanted to make a note that at this point, we have not received any guidance from the Board of County Commissioners, the BCC, as to the direction of where the general funds that public health receives on an annual basis, where that level will be for next year. So at this point, the planning process includes just a stable budget that we will hopefully receive a very similar county general fund support from the commissioners or from the general fund. I will also mention, and I want to just bring more attention to this matter, that there is an expectation that for fiscal year 2025, there could potentially be a significant budget shortfall. So definitely not sounding any alarms, but I believe that the more planning we involve in our process, the more mindful we are aware of that following fiscal year, the better off we will be and the more prepared we will be for that fiscal year. So that was my update. Unless there's any questions, that's all I have for today. Thank you.
Thank you, Joe. Are there questions for Joe? Okay, Jim Rada, you're up.
Hello again, everyone.
Nice to see you.
I have the honor and pleasure of announcing this month's Employee of the Month from the Environmental Health Services Division. I don't see her on the screen, but Mary Sloan is our Employee of the Month for the month of April this month. And I'm glad that I'm making this announcement because about 30 seconds ago, I thought that I didn't have any announcements to make. So I'm glad I didn't forget about it. As a senior environmental health specialist, Mary has taken on many responsibilities and been a great team member and a team player in the environmental land use planning program, our on-site wastewater program. She's involved in our in many of our pre-applications in the land use program. She's helped to develop and improve the efficiency of completing our pre-application approvals for the planning and zoning work that we do. She meets regularly with planning and zoning staff to review requirements on various projects. She's contributed greatly to our on-site wastewater treatment systems team by trying to make things clearer, such as revising inspection forms to be checklists and helping more of our processes be streamlined. She demonstrates her leadership ability and continuously works to serve the community and protect health and environment in Jefferson County. She's a really dependable person, very strong work ethic, gets involved with as many things as she possibly can, sometimes to her own detriment, but we keep the reins pulled a little bit when we know Mary wants to get further on with her career growth as needed. But she's really a great team player. She always is eager to learn different programs and is motivated to share her knowledge and experience with those around her. there's a lot more in the letter that we've provided to her. We made this announcement back at the beginning of the month. We've actually offered her to use the parking place because she does come into the office once in a while. But if you have the opportunity to congratulate Mary, I'm sure she would really appreciate that. And I'm thinking that she's looking forward to having lunch with the board at the end of the month. So thank you very much for the time. And Mary, if you're on, congratulations. If you're not, you're on the recording. Thank you.
Congratulations, Mary. That takes a lot of hard work. You did a fabulous job. Okay, Christine Billings, I know you're on. You wouldn't miss it, right?
I would not miss it, Sherry.
Never.
You're correct. My apologies for not being on the camera. I'm in transition I'm pulled over from a wonderful division meeting with my team today. We meet once a quarter in person to build connection, build collaboration. And today we kind of truly remembered our public health why. So it was a beautiful, inspirational, and educational meeting. I'd like to publicly give my thanks to the Points West team, to Miranda and Carrie for coming over and giving us a presentation on the harm reduction program. It was a really great opportunity to show how all of the work that we do in epidemiology, planning, and communication crosses over with Points West. So that was awesome. Few updates. Jody updated on the community health assessment that is now in the hands of our health communications team. I would like to give a huge high five to the health communications team for successfully hosting, and doing all of the work related to our Public Health Champions Lunch at the beginning of April. They did a wonderful job highlighting the work of not only JCPH in our annual report, but our public health champions who won the awards for 2022 highlighted in 2023. The videos were beautiful, inspirational. Harriet caught me crying over a couple of them. So it was really wonderful to see their hard work be displayed so successfully. I'd also like to share that our case counts for COVID are nice and low for reported cases. And we are continuing to move forward with a contract and a scope of work to extend some of our funding related to that work into early 2024. The idea being that this will allow us to truly move all of our COVID-19 response documentation work, case investigation into our routine disease investigation work. So we are very thankful for that opportunity and looking forward to, as someone said today in our meeting, breaking up with COVID. So it will be nice to have that time and the financial support to make that transition. I'd also like to share that our emergency preparedness team has successfully again moved out of the Dakota building into the Parfait building, and in collaboration with preparedness, with our COVID response team, with my amazing admin coordinator, Jen, who's taking minutes for us today, we are able to begin the launch of a COVID over-the-counter COVID testing program for Jefferson County that has health equity in mind. The testing is available in multiple languages and will be distributed in a format that is in line with health equity components that we have learned through COVID. With the end of the public health emergency, we know that access to affordable and reliable over-the-counter testing in the transition period may be a challenge. And so we wanted to get ahead of that and be able to have that support for our community. And that's all I have. I'm sorry about my voice. I got my kids' colds.
Well, Christine, I don't think you're busy enough, but we'll see what we can do about that.
Bring it on, Sherry.
Okay, and then we have Alex.
Good afternoon, everyone.
Family Services.
Yep, Family Services. So my one update for today is that staff from Family Services will be participating in the reinvigoration of the Bright Futures Roadmap on Thursday, May 11th. And the Bright Futures Roadmap reflects a shared community vision to best support the county's children prenatal through age 8 and their families. The roadmap was originally developed over a year-long period in 2019. And then, as you can imagine, for the most part, the work of the roadmap paused as partners shifted their focus, energy, and capacity to responding to the pandemic. So over this past summer, members of the original steering committee reconvened, and after many conversations with families and employers and other partners across the county, concluded that the roadmap still aligns with community needs and developed an action plan for moving forward based on the current early childhood landscape. JCPH, and specifically Family Services, has been and will continue to be actively involved in the Cornerstone 2, which is focused on supporting an array of home visitation services that meets families' diverse needs. So we're very excited to be collaborating with partners to move the Bright Futures Roadmap forward on the 11th, and it is open to all. So if any of the Board of Health members are interested in participating, I'm happy to share that information on how to RSVP. And that's it.
Well, thank you, Alex. You know, the one comment I want to make, because all the senior leadership team is here, and I know that several of the board members made it to this as well, having the Public Health Champions Awards that were given out. It was a wonderful luncheon. And I was just amazed, because it's just these community partners that nobody really thinks about that are partnered with, you know, the things we do at the health department. And so I know that Harriet was there, Lane was there, Rochelle was there, I was able to go, and a lot of this senior leadership team, I'm pretty sure all of you all were there. So thank you for doing that. I just think it's a great awards luncheon. So thank you for doing that. You reminded me of it, Alex, when I was listening to all of your stuff. I think a lot of it was about puppies and babies. Is that right? Puppies and babies. We have great partners. Okay, let's go straight in and see if there's any staff comments. Nobody's jumping at the chance. Okay, I don't have everybody on my screen, so y'all have to speak up. Board of Health comments. We would like to hear comments from the board. Who wants to be first? Lane has his hand up, and Harriet to follow.
You, and I don't know if I'm stealing any thunder, but did want to share that we're moving forward to get an interim executive director. So I've appreciated the work with the senior leadership team. Hopefully this takes some pressure off of them. We're in this long saga of hiring, and we hope it's done sooner than later, but we know we have to do some stuff immediately. We can't just keep pushing things off. So, but I would also echo, I appreciate all the staff work to recognize those partners and obviously the work of those partners. It's a very, very nice occasion. In fact, I wish all of JCPH was participating in it, because I think it's such a rejuvenating and uplifting event that everybody needs. And again, many folks don't know about some of these partnerships, including staff that are already working in public health. So if you didn't get a chance to at least see what some of that work is, I hope all the staff can at least get some connection to that. But yeah, very much appreciate the work of those partners and all the staff that put that together. It was great.
It was great. Thank you, Lane. And Harriet, you had your hand up. You're on mute.
It does help.
Hey, I always forget to
at the same time I lowered my hand, but it didn't.
You're
work.
fine. I always forget to take the vote after financials. Lane has to remind me. So you have issues with the mute, and I have issues with financial.
Yes, right. Well, anyhow, I also have issues with the sun coming in the window. It's pretty weird, but so I want to echo the the comments about the Community Health Champions Awards luncheon. It was great to hear the wonderful things that are going on. The other thing that was really great for me about that luncheon was the chance to meet so many people who've just kind of been a little box on my computer screen up until now. I mean, I'm a real introvert, you know, so there's some things about the pandemic and having been in isolation all of this time that have felt fairly comfortable for me, but I've also really missed the human contact and meeting people in person. So it was great to have that. Similarly, it was wonderful to attend my first Employee of the Month lunch, since I decided it really was time for me to take a few risks and stop pretending like a really old person and start getting out into the world a little bit. Particularly to congratulate Kelly on that, who just happened to then come do a presentation at a group I'm a part of later that week. A great job, by the way. So anyhow, I'm just thrilled about the fact that we're moving to a little bit more human interaction and I'm meeting people that I haven't met, even though I think we've been working together well. So that's all.
You know, I second that. It was so funny to see people that all you've seen is that they've been on the virtual side. And I noticed a lot of us were commenting, and they were commenting to us, oh my God, it's so nice to meet you in person. Yeah, I think we've all missed that. And even some of the board members, I had never in person met Rochelle. And so it was really nice to actually put a real face to that. So
I had never in person met Lane.
Oh, that's right.
So,
isn't that something?
Yeah, so meeting both Lane and Rochelle was a treat.
That's just not right. I'm telling you, we got to fix that. Okay, Rochelle, did you have anything?
Yeah, I also wanted to just, mirror everybody's comments about the Champions Luncheon. It was very nice. The event was very nice, and it was wonderful to be able to watch those videos that the team prepared and put together for us to highlight the extraordinary work that's going on in the community. So I thought that was great. Alex mentioned about her event and forwarding us some information about when that takes place. Alex, if you forward that to Lindsay, she'll get that to us because it would be great to be able to support that as well. Some of us are available, so please do share that. And then I just look forward to our Employee of the Month celebrations as they happen, and being able to be with people and get to meet some of you again in public. It was very nice at the luncheon to meet some of my peers that I hadn't had a chance yet to meet. So absolutely.
Thank you, Rochelle. And yes, Alex, if you would just get that May 11th information to Lindsay to get out to us. Our board members have just done a lot trying to just get to different things when they can break away from the day jobs that they're strapped to. So we like to, learn as much as we possibly can. And I just want to reiterate what Lane said, and thank you, Lane, for saying that we definitely are moving forward with the interim executive director process. And so we're very excited about that. And I know that you all will be too. And then the only other thing I want to mention is we have the luncheon for the Employees of the Month, the 25th of this month, Tuesday. It's always this last Tuesday. And if you have not gotten to come, it is a real treat. You really should try and make it. So that's all I have. Is there anything else that anybody wants to bring before we adjourn? Well, I don't see any hands going up. So with that, we will adjourn the board meeting at 4:55. Good job, you all.
Thank you. Have a good evening.
Thank you. Bye-bye.